Alert: 5 medications that can cause severe dementia. Know the risks. Mary, a 62-year-old, was always active and full of life. She loved spending weekends with her grandchildren, solving crosswords, and taking long walks in the park. But as the years passed, she started to notice that her memory was not the same. Small forgetfulness became frequent, lost keys, forgotten important appointments, and sometimes she just couldn't recall names that were always on the tip of her tongue. Concerned, Mary went to the doctor. What she discovered was shocking. Her memory loss wasn't just due to aging. The real culprit was her daily medication routine. That's right, the medicine she had been taking for years for issues like acid reflux and insomnia were slowly affecting her cognitive abilities. In this video, we'll explore the 5 most common medications that can cause severe dementia, the same ones that affected Mary. If you or someone you know uses any of these, it's crucial to understand the risks and how to protect your mental health. Pay attention, as this information could change how you take care of your mind. Omeprazole, one of the most commonly prescribed medications for treating issues like heartburn and acid reflux, has shown concerning side effects when used long-term. While its effectiveness in relieving gastrointestinal discomfort is undeniable, recent studies indicate that prolonged use of this proton pump inhibitor may be linked to cognitive decline. People who take omeprazole for more than 3 years often report symptoms such as memory loss and difficulty concentrating. This happens because omeprazole can interfere with the absorption of crucial brain nutrients, such as vitamin B12. Without adequate levels of this vitamin, the central nervous system can begin to suffer damage, resulting in cognitive dysfunction over time. Additionally, the blood-brain barrier, which protects the brain from toxins, may become more vulnerable due to prolonged exposure to omeprazole, increasing the risk of dementia. Therefore, it is essential that patients on long-term omeprazole therapy discuss with their doctors the possibility of reducing or replacing the medication. There are natural alternatives and lifestyle changes that can help manage reflux without compromising brain health. Small changes, such as adjusting your diet and avoiding trigger foods, can be effective in reducing the need for medications like omeprazole. Anticholinergics are medications widely used for various conditions, such as allergies, depression, and urinary incontinence. However, prolonged use is associated with serious risks to brain health. Studies show that continuous use of these medications can increase the risk of developing dementia by up to 54%. This occurs because anticholinergics directly interfere with acetylcholine, a neurotransmitter crucial for memory and learning. When acetylcholine is blocked, the brain struggles to perform essential cognitive processes, which can lead to memory problems and, over time, the development of dementia. It is alarming to realize that many of these medications are regularly used by elderly people, the age group most vulnerable to these conditions. While the impact may not be immediate, prolonged use significantly raises the risk of permanent damage. To minimize this risk, it is important for patients to talk to their doctors about the continuous use of anticholinergics, seeking alternatives that do not harm cognitive health. Medication changes or non-pharmacological therapies may be safer long-term options, ensuring symptom relief without compromising memory and brain function. Benzodiazepines, such as diazepam and alprazolam, are often prescribed to treat anxiety, insomnia, and other nervous system-related disorders. However, prolonged use of these medications is strongly associated with a doubled risk of developing Alzheimer's disease. These drugs, which initially provide relief, can, over time, cause deep damage to brain function, particularly in older people who use them for long periods. The primary concern with prolonged use of benzodiazepines is their impact on brain plasticity and the ability to form new memories. Studies indicate that these medications may interfere with the brain's ability to regenerate, which can accelerate cognitive decline. Additionally, by suppressing normal sleep mechanisms, which are vital for memory consolidation, they directly affect processes critical to mental and cognitive health. For those dependent on these medications, it is vital to consider other therapeutic options. Behavioral therapies, meditation, and alternative treatments for insomnia and anxiety may be safer paths to preserving mental health and avoiding the risks associated with the continuous use of benzodiazepines. Transitioning to these approaches should be done under medical guidance, ensuring a safe discontinuation of the medications. In addition to considering a reduction in the use of benzodiazepines, it is important to reinforce brain health in other ways. Supplements like omega-3, B vitamins, and antioxidants can help maintain a healthy brain and improve cognitive function. If you want to learn more about supplements that can really make a difference to your mental health, check out the link I left in the first comment. It contains research-based recommendations that can help protect the brain naturally and safely. Corticosteroids are often used to treat chronic inflammatory conditions, such as asthma and autoimmune diseases. Although extremely effective in controlling these diseases, prolonged use of these medications can have a negative impact on mental health. Patients using corticosteroids for extended periods often report problems such as mental confusion, difficulty concentrating, and, in some cases, severe disorientation. These effects occur because corticosteroids can alter hormonal balance and directly impact brain regions responsible for cognition, such as the hippocampus, a crucial area for memory. By affecting these systems, continuous use of corticosteroids can accelerate the cognitive decline process, especially in the elderly, increasing the risk of dementia. Additionally, prolonged use can trigger psychiatric symptoms such as depression and anxiety, further worsening brain function. For those requiring continuous corticosteroid treatment, it is important to regularly monitor mental health and discuss with the doctor the possibility of adjusting the dosage or seeking complementary therapies, reducing exposure to these medications when possible, and adopting strategies that promote brain health, such as mental and physical exercises, can help mitigate these side effects. Amphetamines, widely prescribed for treating attention deficit hyperactivity disorder ADHD, are known to improve focus and concentration. However, prolonged use of these substances can come at a significant cost to brain health. Studies suggest that, over time, continuous use of amphetamines can lead to memory loss, reduce cognitive performance, and, in some cases, cause permanent brain damage. The impact of amphetamines on the brain is related to the increased release of dopamine, a neurotransmitter that plays a vital role in regulating mood and cognitive functions. While this brings immediate benefits for controlling ADHD symptoms, prolonged use can wear down the system, resulting in failures in short and long-term memory, as well as affecting the ability to make decisions and solve complex problems. For those dependent on these medications, it is important to seek a balance between symptom control and long-term mental health preservation. Periodic reviews of treatment with healthcare professionals and the inclusion of alternative methods, such as behavioral therapy and meditation, can be essential to minimize the risks associated with continuous use of amphetamines. Now that you know the impact certain medications can have on cognitive health, it's time to take action. If you or someone close to you has been using omeprazole, anticholinergics, benzodiazepines, corticosteroids, or amphetamines long-term, think carefully about the risks discussed here. Is it worth compromising your memory and brain function? Talk to your doctor and see if there are safer alternatives. Don't wait until the symptoms worsen, as happened with Mary. Your mental health is as important as any other part of your body. Are you ready to change the way you take care of your health? Have you thought about reviewing the medications you take daily? Leave your thoughts in the comments below. And don't forget to subscribe to the channel and activate notifications to keep receiving essential tips like this. And if you want to keep learning about how to preserve your health as you age, don't miss the next video, 15 Hidden Dangers Causing Balance Loss After 60. Discover how to avoid falls and stay stable and safe at any age.